Hi, doctor. How are you doing today?
Fine, thank you.
Good to know. We're here to ask you some questions about the immune system. We're totally concerned about the function of the immune system and its disorders, but we would like to know more about three specific ones. The first one is autoimmunity. Do you know what is its main cause?
Well, yes, of course, but autoimmune diseases do not have one specific cause. Rather, there seems to be a combination of factors involved. It can be family or personal history involved, bacterial and viral infections, or stuff like that. Touching some metals, stress, smoking, and sometimes vaccinations. Did I answer your question somehow?
Yes, totally. And is it very dangerous or just like a common flu?
Of course, it's very dangerous because it consists of the inability to differentiate among dangerous and healthy cells. So it is very dangerous to have this disease. You will need rapid treatments.
We'll totally take into account that. The second type is hypersensitivity. We're concerned that there are four types of this disorder, but we don't fully understand the differences among each one. Can you briefly explain them to us?
Yes, of course. Look, I'll try to explain to you type 1 and type 4 because they are the most common ones. Type 1, immediate hypersensitivity, is very quick. The reaction time can be seconds to minutes after exposure to the allergen. This type of hypersensitivity starts with a prior sensitization to the allergen, or IgE, is produced specific for the allergen. Type 4, delayed or self-mediated hypersensitivity has a much slower reaction time. It takes 12 to 24 hours to start developing. Antigen does not bind to antibody. It binds to antigen presenting cells and T cells. As with type 1, the reaction is due to a prior exposure, but in the case of type 4, memory T cells are produced. Both types 1 and type 4, inflammation is a common result. I hope that you understood.
Yes, of course. And is there a specific treatment or a medication?
Well, the best way to treat hypersensitivity is to avoid the allergen that causes it. Also, proper ventilation and using respiratory masks can help, but not specific things I'm aware of.
And how long do reactions in the body take so we can notice them?
As already stated, it depends on the type of hypersensitivity. Some can be in 1 second, while others can take up to 24 hours.
And the third type of disorder is immunodeficiency, and we know that they are divided into primary and secondary. But what's the way to prevent them?
Well, prevention of primary immunodeficiency depends on the identification and genetic counseling of likely carriers to family with a positive history. X-linked disorders may be excluded by sex determination.
And at last, how can we know if someone has immunodeficiency?
It's easy. Patients with immunodeficiency often look ill, for example, with pale skin, general malaise, and distended abdomen. Various skin manifestations may be apparent, such as rashes or vesicles. The eyes may be inflamed and infected.
Thank you a lot, doctor. Thank you for giving us your time, and we appreciate that you shared this knowledge with us.
You're welcome, guys, and I hope that I helped you somehow. And keep working hard.
'Cause it's a